So the atrium of the middle meatus is a shallow depression which is lying in front of the middle turbinate above the nasal vestibule. As you can see here, it is in front of the middle turbinate and above the nasal vestibule. There is an elevation which is anterior to the attachment of the middle turbinate. When pneumatized, it contains air cells, the agar nasal cells, which communicate with the frontal recess. An enlarged agar nasal cell may encroach on the frontal recess area, constricting it and causing mechanical obstruction to the frontal sinus drainage. Here you can see the agar nasal, which is an elevation anterior to the attachment of the middle turbinate, and it communicates with the frontal recess. Pneumatization of middle turbinate leads to enlarged ballooning out of the middle turbinate, which is called concha bullosa. It drains into frontal recess directly or through agar nasal cell. Haller cells are air cells which are situated in the roof of the maxillary sinus. They are pneumatized from anterior or posterior ethmoidal cells. Enlargement of Haller cells encroaches on the ethmoid infundibulum, impeding drainage of the maxillary sinus. Next, we have the osteomeatal unit or osteomeatal complex. It is an area where ostia of the frontal, ethmoidal and maxillary sinuses drain into the middle meatus. So it is an area where some sinuses are draining into the middle meatus. It is a common drainage pathway of the anterior group of the sinuses. Then we have superior turbinate, and it is also ethmoturbinal, and it is situated posterior and superior to the middle turbinate. It may also get pneumatized by one or more cells. It forms an important landmark to identify ostium of sphenoid sinus which lies medial to it. Next, we have the superior meatus, which is a space below the superior turbinate. Posterior ethmoidal cells will open into the superior meatus. The number of posterior ethmoidal cells varies from 1 to 5. Onodi cells, onodi cell is a posterior ethmoidal cell which may grow posteriorly by the side of the sphenoid sinus or superior to the sphenoid sinus for as much distance as 1.5 cm from the anterior surface of the sphenoid. Onodi cells, they are surgically important as the optic nerve may be related to the lateral wall. Then there is the sphenoethmoidal recess, which is above the superior turbinate. Sphenoid sinus opens into the sphenoethmoidal recess. Supreme turbinate is sometimes present above the superior turbinate, and it has a narrow meatus beneath it. So maxillary sinus is the only sinus which is present at birth. Frontal sinus develops around 7 years of age, and sphenoid sinus develops around the teen age, and ethmoidal sinus is present at birth as well, and it continues to grow. And maxillary sinus is also present at birth, and it also continues to grow. However, frontal sinus is present at 7 years, and sphenoid sinus is present until the teen years. Let's talk about the drainage of various sinuses. Okay, so frontal, maxillary, anterior ethmoidal cells and middle ethmoidal cells, they are going to drain into middle meatus. And for the superior meatus, remember that posterior ethmoidal cells and sphenoid sinus will drain into the superior meatus, and inferior meatus does not receive any paranasal sinuses. Instead, it drains the nasolacrimal duct. The ostium of the sphenoid sinus is situated in the sphenoethmoidal recess, which is medial to the supreme turbinate or superior turbinate. It can be located endoscopically about 1 cm above the upper margin of the posterior choana, close to the posterior border of the septum. Now we are talking about the middle meatus, medial wall. So medial wall is formed by the nasal septum, and for the floor is formed by the palatine process of the maxilla in its anterior 3/4 and horizontal part of the palatine bone in its posterior 1/4. Next, let's talk about the roof of the middle meatus. So anterior sloping part of the roof is formed by nasal bones. Posterior sloping part is formed by the body of the sphenoid bone. Middle horizontal part is formed by the cribriform plate of the ethmoid bone, through which the olfactory nerves enter the nasal cavity.